Hi there. It's Seth Maxwell, founder and CEO of Thirst Project. And like all of you, our team has had a tough time working remotely from home these past few weeks as we've worked to migrate all of our programs and operations digitally, as we've worked to live within the critically necessary social distancing policies that we're all living under to try to fight the spread of COVID-19. And although it's been a tough few weeks, I'm so proud of how our team has risen to the occasion time and time again to fight COVID-19, both here at home and in all 5 countries that we work in. 1 week ago today, we updated you on our activities in all 5 of those countries. And at that point, we had already pushed pause on all drilling and construction activities within those countries. And we were working with our field team to develop our own action and response plans for what we ourselves could do to try to fight COVID-19 within our sector. As we've said multiple times, our biggest concern throughout this process has been the fact that the communities that we work with, these rural communities, are the most vulnerable to the virus itself. People living in the communities that we work with don't have access to strong franchise public health systems. In many cases, there are no hospitals. And before we build water and sanitation and hygiene projects, people often are unable to wash their hands as regularly or thoroughly as they need to protect themselves. And so we spent the last 2.5 weeks working with our teams on the ground to disseminate super critical information into all of the communities that we've worked with to alert them of what was coming and remind them to practice the hygiene and hand washing trainings we'd already taken people through when we completed our projects. Similarly, if local governments hadn't done so, we began to introduce the idea of social distancing and particularly discourage commuters who traveled back and forth between urban or peri-urban centers and their own communities who might pose a risk as a vector to carry the virus back home. So when finally this past Saturday, the last of the 5 countries issued a lockdown and restricted activities for work on the ground, our teams complied. It has since been deemed by the government that our work and our in-country team members who can contribute to this public health effort are not only essential, but we as an organization have been formally asked by the government to do so. This Monday, March 30th, we were asked by the Ministry of Health in Eswatini in partnership with the Ministry of Natural Resources to respond to an all-hands call for help. The Ministry of Health is coordinating an effort amongst the WASH sector, the water and sanitation and hygiene sector, being made up of all the stakeholders on the ground within the country, so all of the government workers in the space, as well as all the NGOs in the space, and anyone else who may be willing to volunteer. They've organized their initial response to COVID-19 in the WASH sector, the key goals and outcome of which center around prevention and hygiene and hand washing, both in the form of physical resources and supplies for hygiene and hand washing materials, installation, as well as also proper training for those communities. As one of the leading organizations in the space in Eswatini, Thirst Project has answered the call. We have committed $100,000 immediately in funding towards this effort and the specific goals that the Ministry of Health have outlined, and our in-country staff and personnel have also committed to provide manpower to help in the implementation of these goals that the Ministry of Health and the Ministry of Natural Resources have prioritized. Moving forward, during this period of crisis, we are committing any public donations to be directed to our COVID-19 relief fund. To find out more about our response, head to thirstproject.org/COVID-19 and stay tuned for more updates.